A total of 9 suspected cholera deaths were reported in the last 24 hours from 246 new suspected cases. There was also 23 laboratory confirmed results. Of the new suspected cases, areas that had some of the highest numbers include Mazowe with 29, Kuwadzana 22, Chitungwiza 22, Chiredzi 19 and Glenview the same number. A total of 308 cases were hospitalized, with Chiredzi having the highest number at 17. There were 262 new recoveries recorded and the national recovery rate stands at 96%. We get more in the following report.
9 suspected cholera deaths is too much of a big number. That's how serious this cholera outbreak is. Fears are if the situation continues to deteriorate, the country could reach the 2008 levels. On the ground, the sight of government actively supporting local authorities has been a big relief for many. On Wednesday, the issue of water sanitation in the country was being discussed with government and other players involved. On the same day and today, government continued in their efforts to try and improve town planning as a foundation that can help towns and cities get out of the mess. Government has been preaching unity in the face of the outbreak.
When we are confronted by a challenge, it shows that if we work collectively in a non-partisan manner, a political nature, because the cholera, typhoid and water do not know these boundaries. It means as Zimbabweans we can surmount, we can emerge, and we can conquer, we can surmount.
One of the issues that has been spoken about in the weeks has been that of vaccination. A public health expert believes it works along with other interventions.
What we may need to do now is to deploy the cholera vaccines. And this can initially target, the hotspot areas, areas such as Harare, Chitungwiza, Buyera, and all those other areas where we are currently having high numbers of cholera cases.
He also spoke about other measures that could help the country manage the outbreak.
Cholera response is not just the responsibility of the government and the local authorities. We need to have the other stakeholders coming on board. The private sector should come in with the required resources.
This in many ways remains a big challenge for the country, and it is expected that government will continue to work with towns and cities to contain the outbreak. However, after the cleanup campaign launched last week, residents have called on such initiatives to be continuous. For ZTM Prime, I'm Stachisiokwa.